This is Pretty in Practice, the podcast.
Opinions expressed on this podcast are solely those of our own as well as our guests and do not reflect the views and opinions of our respective employers, organizations, academic institutions, committees, other groups, or individuals.
Welcome back to another episode of Pretty in Practice, the podcast. We have a little bit different topic for us today, and we want to call them hot topics. So things that we've all seen in the community, like BBLs, veneers, and even we're going to talk about a new study on UV nail lights. So stay tuned for that. As always, we're going to start with the doctor's diary. I'm going to ask Lacey to pick a number, even though I know a number she's going to choose.
Of course. Numero dos.
Anyway, so the question is, what's the most embarrassing fashion trend you used to rock?
Oh, Lord. I'm so
And honestly, I think I'm going to go first because we was talking about this earlier. And I was talking about how one time I had, like, colored bangs. They was blind. Another time I stuck a highlighter pink hair in my head.
I saw the picture.
And that's very embarrassing because why would I do that? But yeah, I think those are my most embarrassing times. I hope those pictures are deleted off of my social media.
I think mine was probably that skinny jean era where we did like skinny jeans or leggings with like the baby doll shoes.
Yeah.
Did y'all
Like
do baby boomers
looking
too?
back on that, I just be like, what were we doing? Like, what is this? So yeah, not my proudest moments.
Mine is terrible. The gauchos, you know?
The gauchos, what
Yes,
else?
the wide leg pants.
And they came like
Aren't they gonna
knee.
Well, I don't know, but now that I see the pictures pop up on the Facebook memories, and I'm like, ooh, Jesus, girl, what were you doing? But yeah, those were, just not it.
I'm going to go here too because we was talking about this earlier. So there was a trend called yarn braids where you literally braided yarn into your hair, and I had that twice. One time I had like purple yarn braids, and then the other one I had like this multicolor into my hair too. It was real good and ghetto. But
That's funny because honestly, I've seen a girl on TikTok do yarn braids, but she used black. So it was just kind of like, I don't know.
So it kind of blended. I think I know
well,
what you're
mine
talking
was
about.
black, but then it was like pops of color.
But yeah, like, she just did her own way in like black. So I was like, maybe it's coming back, or maybe it never
you
left.
recently seen it.
Yeah, like it was on TikTok. Yeah.
Well, look at that.
So,
I was setting trends.
Right. They say everything comes back.
They do. They do say that.
I agree.
But yeah, so number one on our hot topic list is BBLs. I know we've all heard of them. I know we've all seen them because
Very hot topic.
it is very hot topic. So just to give more clarity on what a BBL is, it is a Brazilian butt lift. And the Brazilian butt lift is a gluteal fat grafting procedure. So basically it utilizes excess fat from other areas of your body. And they add that to your butt. So this can help increase the volume, it can increase the projection, and honestly give you a perfect overall shape and symmetry, because I've seen some really, really great BBLs out
I
there.
definitely have.
Like, wow, that's a banging body.
Mm-hmm.
But yeah, so what do you guys...
I can
interesting.
talk about it because we did talk to someone who got a BBL just to understand like the experience and kind of the prep for it and the aftermath of it. And so from her experience, we asked her like, so how did you find the doctor pretty much? And so she said she joined an Instagram community and kind of started there where she would go through different pages to see the doctor's work. And she preferred a U.S. destination because I'm sure we've heard of those stories where people go overseas to get them and may not have like the best health outcomes, may get sick. In some cases, it can be fatal. So she went the route of having a U.S. physician. And then she talked about her experience as far as going to get the surgery, which she said really wasn't that bad. Obviously, they do get put under anesthesia, so she wouldn't remember the exact surgery. Nevertheless, she stayed in a recovery house afterwards for 3 days. And in that recovery house, they had 24-hour nursing staff to take care of them, which is something new that I learned. I honestly didn't know that. And so the nurses can like administer medications, help them with their massages, help them, get up, sit down, go to the restroom, etc. She did say one of the stipulations that was kind of surprising was that like you can't sit on your butt directly. We asked her like how long, and she's like pretty much as long as you can go without sitting down. Is the best case scenario. So for people who travel to different states to get it, oftentimes when the seatbelt sign is off, like on the airplane, they would just kneel during that time and then sit, obviously, when they required the seatbelts to be on. So I thought that was pretty interesting. She also talked about in her recovery the massages, and she said that was actually the worst part from her own personal experience, because that was the part that was the most painful. And these massages, she said that she was getting like every other day at first for the first couple of weeks, and then she got to the point where she bought her own recovery materials and her own massage materials so that she can do those at home. And for this specific person that we talked to, she was 2 years post-op during this conversation, and we asked her, like, have you had any complications from it? And she said, other than losing fat, she hasn't had any complications, which I was very happy to hear, just because I feel like we talk about, like, obviously it makes us look great when people get them, but also there are so many other things that we have to worry about. So to hear that someone has a success story, I think is a good thing. But I did want to talk about very, very briefly, because this is more of like an informal episode, but I want to talk about some of the risk or complications that can occur with the Brazilian butt lift. So as we know, or as you may not know if you're not in healthcare, but our butts contain many blood vessels and nerves, and if the cannula that they're using during surgery strikes any of these structures, it can lead to injury, a fat embolism, or death. It can also lead to infection, which, depending on what the pathogen is, can lead to like sepsis, which is a blood infection, so that could become fatal as well. And then some of the mild things like bruising, skin discoloration, and then simply just not healing well or not getting the results that you wanted to get. And another thing I want to weigh in on is, although she said that her surgery was around $6,200, she ended up spending about $12,000, including the flight, the recovery house, the massages, and the tools needed after surgery.
And that's not, and of course it's cosmetic, so the insurance is not going to cover that. So it's like, it's interesting when you think about it, because it's like, okay, I am paying like all of that out of pocket. And if I think about it, most cosmetic procedures are not covered by insurance. I know like gastric bypass is technically not considered cosmetic, but that can be definitely covered by insurance. And then there's a surgery after, and I forget the skin removal surgery, where that can actually be covered by insurance, because they're losing a lot of weight, and then that excess skin really can be hazardous to their health. Like it can be a health issue, and so they can actually get coverage for that. But the BBLs, they are definitely on the rise for sure, especially, as we see on TikTok, a lot of us, that are on social media, it's an uptake of people going to other countries to get them done, and that's where we're seeing a lot of the unfortunate complications and different things like that. And don't get me wrong, there are definitely qualified physicians. All of the qualified physicians can't exist in one country, so obviously, there are qualified physicians, but when you're thinking about if something's significantly cheaper, usually there's a reason why. Of course, different countries have different currencies, so that's going to contribute to lower costs. But when they say if something seems too good to be true, it probably is. If you're talking about roughly a $12,000 total cost when you factor in everything, which is what she had mentioned that she paid, and then you're going somewhere you're paying $3,000, like, red flag, you know what I mean? So I think regardless, it's a personal decision, but at the end of the day, like, go to a board certified physician, surgeon, if you're going to get something done, because the thing with BBLs is they are risky because of, what Dee said, and that's why we're hearing about these stories of, unfortunately people losing their lives over this cosmetic procedure, something that you would think would be pretty seamless. You go in, you're getting some fat removed, and they're going to take it from one place and put it somewhere else. You would think, that there would be low risk factors, but it is a risky surgery because of that, because of the location. And so if you have somebody that's doing it that doesn't have a lot of experience, because it could be an experienced surgeon, but just because they're experienced as a surgeon doesn't mean they're experienced in this particular area. And that's another thing too, like when you're looking for individuals, you want someone that has done this particular procedure. Like if you have a surgeon that specializes in the face and you're going to them for a BBL and you're like their second BBL, but like they're really experienced in facial and aesthetics and surgery, like it's like, okay, like do I really want this person to be operating on this other area of my body? Like probably not.
You gotta do your research, and those stories that you hear, they're not far from home. I mean, like our home specifically, I remember in Indianapolis, our home state where me and Lacey is from, there was a huge story about a young girl who unfortunately died. She went overseas to another country to get the surgery, and she unfortunately was one of those fatal situations from it. So it's definitely very real, and you definitely have to do your research to make sure that you are taking all the risks into account, and also know why you're doing it. If it's pressure because it's hot right now, it's on TikTok, all the celebrities are doing it, might not be the right reasons. But if you're doing it for yourself, then more power to you. But I just want to make sure, especially us as women, as young women, are taking into account just the lifelong impact that it has, and also take into consideration that our bodies is going to change, especially if we're in our 20s and 30s. We haven't even got our grown women weight yet. So you might not have a certain asset on your body right now, but that could come later. Like there's things like pregnancy that definitely
as you know,
definitely gives you multiple body parts. So just take all this into consideration, do the best thing for you, but also don't let the pressure of society force you to make that decision.
Even they're even going overseas now for nose jobs. Yeah, I have seen that a lot too. Turkey is a hot topic now. People going to Turkey for nose jobs, and I'm not gonna lie, I've seen some good ones. I mean, very just natural. Like if you saw the person, like you wouldn't know, but when you see like the before and after, it's like, oh, okay, I do see the difference. Like I saw one on TikTok the other day, I'm like, wow, like I'm not gonna lie, girl, they hooked you up. So like I've heard that recently. And then another thing too, of course, are breast implants. That has been something that I've seen a lot lately as well, especially when it comes to like long-term complications. I don't know if y'all have heard of some of these complications that are coming out, but people are literally getting ill from their breast implants. And like I remember this one lady was talking about it where she was feeling sick. I don't remember all of her symptoms, but they were doing all these tests and they could not figure out what was going on with her. And then I think a friend that she knew that had implants was like, well, I had gotten sick and they did all these tests, no one could figure it out, and then finally, there was a physician that was like, well, maybe it's your implants. So it's almost like they were having like they were literally having a negative reaction, like their body was rejecting the implant. And so I think these women had implants for like 10 plus years, and then all of a sudden was having this bad reaction and literally got them removed, and it was almost like a 180, like almost immediate. They started feeling better and everything. And so I know a lot of times it's like, well, we don't think, like when we're putting something foreign, because I know it's one thing, like a BBL is a literal fat transfer, so you're taking something from your body and putting it somewhere else. But then when we think of things like implants, I know there's different type of implants, but when you're like putting something foreign in your body, like there's always kind of that possibility of rejection. And I know recently, like we're seeing this more, probably because implants were really popular probably about 10, 15 years ago. Right. So now the individuals that happened to, now they're starting to see what, what that long-term effect is. But I think, in general, when you get implants, I think, the idea is that you are going to have to get them redone in 10 to 15 years. Like, I don't know if y'all have heard that, but I'm pretty sure it's about 10 to 15 years. Like, it's kind of expected that you would need them redone. Not even including if you have kids or decide to have kids and stuff like that. So I know a lot of people say don't get any type of cosmetic surgery until you're pretty sure that you're done having kids, because like you said, India, all these changes happen at that point, and then sometimes you got to get stuff tucked that you already got tucked, and then now you under the knife multiple times and stuff. So to each their own. I think as long as your doctor approves it and everything, but just something to think about, like if you are planning on having children, you know, maybe use that as a treat for yourself, like once you're done having kids and stuff, and you can see what your body is like after all of that, all of those changes and stuff.
Yeah, and just one clarification, because Lacey was talking about like a foreign implant transplant. Even though BBLs do use your own fat, you're putting fat in an area that it ain't supposed to be there. So you can still get rejections there, or you can have that fat disintegrate. So just keep that in mind. Just because it's natural and it's your body, you still can have like complications with that transfer.
I recently learned that. I didn't realize, and I guess it does make sense, but I literally just learned that today, that the fat can disintegrate, or you can lose that fat. Because if you think about it, when we're trying to lose weight, you know, we're trying to lose fat, right? And so we exercise, we eat a certain diet, we can lose fat. And so I learned recently that if you don't keep up with a certain diet, that BBL can like actually be smaller, because the fat, you know, you can lose that fat. And I didn't realize that. And I'm like, I guess that it does make 100% sense, because you can lose fat anywhere. So why wouldn't you be able to lose fat just because you put it somewhere that you want it? So I'm like, wow, like, and I don't think a lot of people know the maintenance that comes with BBL. Like, it's not one of those things where you can just get it once. I mean, you just get it and that's it. Like, you actually have to maintain it. You have to exercise to maintain it. You have to make sure you're eating enough to maintain it. So I'm like, oh wow, like, okay, so I could do this procedure, but then I got to do all this work. People
And some people get it,
makes you kind of think.
like who we talk to, some people have to go and get it done again a few years later because they were not able to maintain it. So yeah, that's also something that I learned today. I'm like, oh, I'm thinking it's a one and done. I did know about like the food restrictions and like exercising, but I didn't realize that some people go get it done again.
I didn't know that.
So that's also something to think about, because we talking from going $12,000, now we at $24,000.
Oh, Jesus.
If the costs are similar depending on where you go. So
by the time you get it done again,
to
it's
like
probably
consider
Yeah,
when deciding.
And I feel like the more we see it, the more they're going to start charging more for it, because they can.
Absolutely.
So it's just going to
Supply
keep
and
going
demand.
up.
Yes,
Exactly.
I agree.
Think about Dr. Miami. Like, he's literally one of the most popular physicians, and what surgery made him popular? The BBL. You know, and he even, if I'm not mistaken, it's either him or another popular surgeon. They literally have packages now. You go on the website and it's like package A is just lipo, package B is BBL.
Oh, you go up to premium packages.
Literally.
Oh, okay.
And then like package D is like the ultimate mommy makeover. I mean, you're getting a tummy tuck, lipo, a BBL, a fat transfer, like all of this. And I mean, it's almost like, it's like you going to Burger King and like you see, like, I want a number one, please. Like, you know, I want the number one BBL package. Like, it's getting to that point now where it's so high in popularity that the physicians are capitalizing on it. And they're like, hey, you know, this is what's making me my money, and this is like, because I know he does a lot of different procedures, but most people only know him for that particular procedure, and that's what he's been able to capitalize on. He's extremely popular now on TikTok, and all of that came from his, you know, exactly.
So you spoke about that being popular in cosmetic, and so I want to move into the veneers, which are also cosmetic in nature and becoming very popular. So just to give some kind of background on veneers, there are various types of veneers. And what they are a custom-made shell that fit over the front surface of your teeth. So a lot of times this conceal things like cracks or chips or stains or anything that you think is cosmetically imperfected. So then there's two popular ones. There's porcelain, and then there's composite. So they both differ a little bit in how you make them. But one thing I thought was really important to note is that like porcelain costs more, but porcelain is also going to last you 10 to 15 years.
Right.
So we also can note that we have to do it again. So a lot of these cosmetic surgeries you have to do again. And then the composite only lasts 5 to 7 years, and it's much cheaper. So yeah, that's just something to note, like seeing all these people get these done, and a lot of them don't know that like their teeth are getting shaved down, like your teeth under there have to be healthy, and you just have to visit someone who's doing it right, because these are your teeth, and each of your teeth have nerves that run through your whole body.
Don't forget about those nerves.
Like that's crazy to me.
That's the shaving down of the teeth. I think that's the biggest concern for me. is like, I would never, and I know there's two types, so I don't know I don't know the details of like which is which, but there's one type that doesn't require the shaving of the teeth, and then there's another type that does. So whatever that type is, I've seen like a lot of dentists like speaking out on that, because if you think about it, if you have perfectly healthy teeth, like a perfectly healthy tooth, and then you're shaving it down to this like nub to put something artificial on it for really aesthetic reasons only, I don't think there's any particular health benefits. Yeah, I think it's only cosmetic. So in that case, I mean, you're ruining like a perfectly good tooth. I mean, and then you have to get it redone. You know, I've heard of people it chipping, you know, they've fallen out, and then you can't get into the doctor until like a certain amount of time later. So you're literally just walking around with like this. Yes, wow. I've seen that. Like, I've literally seen it. Like, I'm all on TikTok, so I be seeing everything on TikTok. I be seeing everything on TikTok. Like, they were like, TikTok, they need to sponsor me at this point. But yeah, like, I mean, I literally seen this girl on TikTok said that she was on vacation and her veneer broke or got chipped off, and this girl used super glue to put her veneer back on until she could go to the dentist.
Well, I want y'all to know there's glue that you can buy over the counter for teeth. If that happens to anyone, I've actually had my dentist give me that whenever I had temporary crowns in. Like, if it comes off, they tell you to use like this little bonding solution that's specifically for teeth to put it back on. And I'm honestly interested in veneers for myself, not even for aesthetic purposes, so I guess that would be the one time. I would have to talk it over, obviously, with my dentist to figure out if it could help me. But I actually have a lot of issues with my teeth. I think it's more of a genetic thing. Like, they look pretty, and I think they are pretty. I think I got a nice smile. But the amount of money that I spend per year because of, like, dental issues, whether I need a crown or whether it's a cavity that needs to be filled. I recently had to get a dental implant that was upward $5,000. And so, to me, I could potentially benefit from veneers because in my brain, I'm like, heck, this is like a bunch of little crowns on my teeth. I'm already paying for one crown per tooth that needs it. And so I'm honestly looking into it as being an option, because I would rather go get them done every 10 to 15 years than have to go to the dentist every single year and have a bill that is like way too high, and it's becoming extremely frustrating the older I get. So that's just my perspective on veneers. I personally like them, and I think if you get somebody to do them right, they can be very aesthetically pleasing.
When they're right, they look good.
They do.
And
they look good.
That's why me and D are in the same boat, because I also, and similar to D, I have genetic issues with my teeth. I've had multiple root canals just because of the way my teeth grooves are made, and it's cost a lot of money. I'll be very honest and say I wanted them for cosmetics reasons. I think they look good.
And there's nothing wrong with that, because they do look good.
They do look good, but I did recently learn. I knew about the shaving down of the teeth. I didn't know about the going back 10 to 15 years later. I think I just recently learned that, and I was doing the math in my head, and the math wasn't mathing. So I was like, ooh, Jesus, I don't know. So there's still considerations for myself whether or not I would get them, but it's definitely an option that I'm looking into as well.
I don't blame you, because like I said, when they look good, they look good. Now, you know, I've seen the chiclets and, you know, other things where I'm like, okay, you know, but to each their own. No judgment there. But yeah, I've seen them when they look good, they look really good. And I've seen people where they won't get the whitest, because you can choose the color. And so I would say that makes sense. Like, you don't want the white. Like, I've seen some that were like so white they were almost blue. Like on the spectrum, it was almost like they were that white. Like in certain lights, they almost look bluer. So this girl, I remember, she got like, I think she said which shade, like 3 shades from the whitest, and they look perfect. I mean, they really look perfect. So I don't know, y'all, like, might be a good option.
I mean, do what you gotta do for you. Like Dee said, that might be a better option for her health wise. So like, you never know what people got going on, or why they got them. Like, so everybody do what they gotta do for themselves. But our last and final topic is a study that's new. And it's about how they think that the UV radiation coming from the UV lights that cure our gel nails, which a lot of us participate in
Currently.
like, man, like, okay, so now we think this causes cancer, but basically they think similar to the sun's UV rays and tannin bed UV rays, this is the same thing in nail form. So they're finding that it can cause the bacteria that then can recreate into cancer. But they do say that they recommend you could use a water-resistant sunscreen that is like 50 SPF or higher on your hands. But then my question is, what about my feet?
Right.
Because I can't go without the gel on my feet. And it's just sad because it's like, what don't cause cancer at this point? Because, like, do I just risk it because I like it on my nose?
It's giving a lose-lose situation.
Literally everything. I mean, when you think about, like, okay, nutrition-wise, all right, you know, there's hormones in the meat. Okay, I'll go vegetarian. And then it's like, oh, well, there's hormones in the vegetables now. And organic doesn't necessarily mean organic. Like, I'm like, you know what? At this point, like, you do what you got to do. But I actually thought about that, like, well before the study. Because I'm like, oh, they're using a UV lamp, UV rays. So, like, I usually try, and I forget half the time, but I usually try and remember to put sunscreen on, like, before I go to the nail salon. Because usually with the hands, all they do is tell you, like, to rinse your hands. So if you need to apply it, like, either before you go into the salon or, like, right after they tell you to, like, rinse your hands in the sink or whatever, you can apply it. But I think somebody said it needs to be applied, like, 20 minutes before or something like that. So, like, right before you go in, you know, that should be fine, like some kind of water resistant. But then, like Jessica said, what do you do about the feet? Because they scrub in and they put lotion on some of everything. So at that point, I really don't know. It might just be one of those things where you have to say, is it worth it? Or it's just, you know, it's just like we just gonna risk it at that point. Because and just another thing, Black people, please put on your sunscreen when you're going outside. Like, just
I'm like, that's a topic for another day, but I do agree with that.
Just to add that, I just gotta add that.
Yeah, I don't know where that came from, but
yeah, I just had to add that. Please, whether you get your nails done or not.
Like, especially with like melanoma, like a lot of physicians have a hard time like determining it on Black skin.
Exactly.
Which is a whole nother topic too.
That's a whole nother topic. But being a medical student and looking at the pictures that we see in class, very few are on Black skin. I do think they've gotten better, honestly, within the past year. I've been in med school for a year and a half, and I have been seeing like an increase in like the photos as far as textbook goes, as well as what's presented in class. But I agree, it makes it harder. So we didn't even plan to talk about skin, but as a blanket statement, absolutely 100%. No matter what color you are, please, if you're wearing sunscreen.
Yeah. So I think this was a very, very interesting topic or topics today, and a different view. We are no way shaming anybody for BBLs, veneers, or any of that. We believe in do what works for you.
Absolutely.
But yeah, so thanks guys for participating in this episode, and always keep it pretty.
As always, thank you for joining us for the ride. Be sure to keep in touch by following us on Instagram and subscribing to our YouTube channel at Pretty in Practice. Feel free to send us a DM of any topics you want us to discuss, and you might hear them on a future Pretty in Practice episode. Keep it pretty.